the chat. Thanks, Heather. Heather's going to be driving the Zoom, checking the chat. If you've got questions, please use the chat. We're a good team for catching those, and we'll make sure those get addressed. Stephen Barrow is here, over here. Maybe we'll wave. Um, Primary author for this paper, Richard Lau, social planner over there, waving. And we've got Gala's here with us, and one of our research associates for the summer. Very exciting. So here
And
we are.
also one of our summer students, Hiba, is with
Okay.
us as well.
Hiba's in here somewhere. Okay, excellent. Hiba, she just started this week. Just got to meet her yesterday, so how delightful. Wonderful. So welcome everybody. I'm going to begin to share my screen and that's what I'm gonna do. We're gonna get going. uh, and I'm gonna go back to here. We're gonna go from the beginning. Does everyone see screen properly? Perfect. Excellent. All right, so today at Community Data Watch Friday, we're going to be talking about trends and challenges in caregiving in Halton. And it's quite an interesting topic. I think lots of us can relate to. But I want to start with a land acknowledgement. So we acknowledge that Halton is rich in the history and modern traditions of Indigenous people. Halton is on the traditional lands of Mississaugas of the Credit, part of the Anishinaabe Nation that extends from the Niagara Peninsula across Hamilton, Halton, and Toronto to the Rouge River Valley. We thank the Mississauga of the Credit First Nations for sharing this traditional territory with us. We are in Treaty 14, and we also recognize and enduring the presence of Indigenous people on this land. And I think one of the things our friends at Grandmother Voice always teach us to do is just to take a moment, just to maybe if you're close to a window, have a look at the window, or if you got the pleasure of going out for a walk this morning, think back to something that maybe you saw from the land, from nature that, yeah, that just kind of delighted your eyes or took you for a surprise. This morning, I saw a beautiful, kind of squawky group of birds this morning who are very much alive in my neighborhood and grabbing my attention. And I was really grateful for that. It helped to wake me up this morning. And Jody always reminds us that it is the land that connects us. And that is our common piece that we have responsibility for taking care of together. And so I just want to acknowledge that and extend gratitudes for yeah, this beautiful sunshiny day. All right. So for those of you who are not familiar with community development in Halton, this is my elevator pitch. Connecting community is what we do. We do that through a couple different ways. Volunteer Halton. Heather and Hiba are here from Volunteer Halton. Um, Volunteer Halton has been, around for over 40 years. Through our organization, we do workshop series, annual Congress, I'll talk about later. They do advocacy. This year did a fabulous research project on youth volunteerism, the 40-hour policy, one of a kind across the country, and National Volunteer Week celebrations, of course. And if you didn't know, and if you want to go and find a volunteer opportunity right now, you can hold up your phone and go to the QR code. It takes you right to Volunteer Connector, which is the portal that we use to help spread the word about all of the incredible volunteer opportunities that are around in our community. And if you'd like to learn how to use it, please check out our events page because we actually host fairly regular opportunities just to connect and learn about the portal and how to put up a great post. We are also a social planning organization. So we connect people through data. So we connect people, citizens, to opportunities and nonprofits, to education, and our community to incredible data like today. Just quick hit of data. Did you know 2023 tax filer data tells us that our poverty rate in Halton is now 13.1%. And that is higher in some communities like Milton at 15.6 and Oakville at 15.2. We connect you to that data so that you would understand, so that you could plan, and that we could advocate together. Social planning means that we are doing social research, but we're convening community like we're doing today, sparking collaboration and conversation, and hopefully leading to policy and advocacy efforts and change for our community. We want to thank our our ongoing support from the regional municipality of Halton and the United Way Golden Horseshoe for their ongoing financial support for the work of CDH. And in particular today, our research. And we want to also thank all the peer reviewers who took the time to inform this publication. You strengthen our work. We are grateful for you all. All of our publications are peer reviewed by our community, which we're really thankful for. So let's get into this report. I'm going to just talk for about 15 minutes, and then we've got this incredible panel I'm going to introduce you to of people. What I want to say about the data is that the data that is available on caregiving was some great data, particular Stats Canada's Canadian Social Survey on well-being and caregiving from 2022 data. New data is coming, folks. Hope you all filled out your census, but this is great data. We've also looked at Ontario Caregiver Organization Spotlight Series, the Canadian Centre for Caregiving Excellence National Caregiving Survey, and some local service providers provided Halton data and stories. But the primary piece of data was federal and provincial. And our mandate is always to tell the Halton story. And so we convened folks and asked folks and hunted down data sets and to be able to tell the Halton story. So today I'm going to focus on some really quick highlights of the national and provincial data. And then some of the folks who actually provided data or who have stepped forward to help share the story today are here with us as a panel so that we can really hear about how what we heard from the report, how it resonates locally and what the key issues are locally for some of the folks who are in the trenches doing this work. So just a quick introduction, the background caregiving is an essential but often invisible part of Canada's social and economic system. Millions of Canadians provide unpaid care to parents, partners, children, friends, neighbors. The unpaid caregiving supports families, communities, and healthcare systems. So that's really important to know. Unpaid care, the report examines who provides care, sandwich caregiving, emotional, financial, employment impacts, and future caregiving needs. The national caregiving trends, here we go. 42% of Canadians age 15 plus provide unpaid care in 2022. That represents 13.4 million people across Canada. Unpaid caregiving includes support for children, older adults, individuals with disabilities, or long-term conditions. The 2022 Canadian survey shows an increase in unpaid caregiving compared to 2018. The report identifies growth in sandwich caregiving, where individuals care for both children and adults. And when you think about our demographics in our community, we have an aging population. You'll see later that a lot of the caregiving support is with older adults. So it's not surprising as our country ages. And our Halton community, some of our Halton communities, Burlington, for example, have a really large number of seniors. So this is not surprising. Unpaid caregiving is described as a major but often invisible contribution to our social and economic well-being. So here we're starting to get into some of the charts, patterns of caregiving. So who is more likely to be providing caregiving is women are more likely to provide childcare and be sandwich caregivers. And when I say sandwich, it's exactly what you think it probably is. Caregiving for children and for older adults. So you're kind of stuck in the middle. Adults age 35 to 44 had the highest rates of childcare and sandwich caregiving, and adults age 55 to 64 were more likely to provide adult-only care. Interesting. I found myself in that spot recently, so I think maybe like raise your hand if you can relate to some of this data in your own personal life. Married individuals were more likely to provide unpaid care than single individuals. And multi-generational households had the highest rates of dual caregiving responsibilities. So 65% of people in multi-generational households provided unpaid care. That makes a lot of sense if you're living with your parents, or your parents are living with you, or maybe, yeah, you've got your children living with you into adulthood. These things come up. So there's some of the data. You can see the chart there in terms of those percentages. Social characteristics in caregiving. So members of racialized groups were more involved in childcare and sandwich caregiving. Recent immigrants were more likely to provide childcare than adult care. And Indigenous and disabled respondents reporting to the survey reported higher rates of adult caregiving. University graduates, so if you're following along the chart along the left-hand side here, university graduates were more likely to provide childcare, and many employed individuals balanced work alongside caregiving. Um, Caregiving responsibilities remained unevenly distributed across social groups. So that's important to know. And so there's some equity issues that are happening around the caregiving landscape in our community. But yeah, so you've got that own, if you have your own child under age 15, you are more likely to be involved in caregiving to children only. So you can see the green there along the bottom, quite a substantial number, but you can also start to see where the folks who are doing care for adults only, those folks who have disability, indigenous identity, and college or trades. Interesting data set, and to look at the differences in our population around who's doing what kind of caregiving. The sandwich caregiving piece is we're going to talk about that, I think, next, and quite an important piece. So about 1.8 million Canadians were sandwich caregivers in 2022. So those people who are childcare and maybe older adult or another generation caregiving for. Most sandwich caregivers were aged 35 to 54, and women were more likely than men to be in this situation. And 86% reported impacts on health and well-being. 66% reported impacts on employment or job seeking activity. So when you've got a lot of responsibilities at home with multiple caregiving responsibilities, you can only imagine how difficult it is to take care of yourself, stay employed, or if you're looking for work, to find the time to do that. Many reported fatigue, anxiety, and feeling overwhelmed. So if you look over to the chart here, you can see that proportion of unpaid caregivers by relationship and type of caregiver. So we've got caregiver to adults only, or in the blue, and the sandwich caregiving is in the orange there. Um, yeah, and so you can see in terms of providing this 57.1% for sandwich care there with the parent, providing care for a parent. Care recipients. So who is actually receiving the care? Parents were the most common care recipients. So having an older a parent living with a family member, sandwich caregivers were more likely to care for both parents and children, and 45% of Ontario care receivers were parents or in-laws. Adults aged 75 represented the largest group of care recipients, so our older seniors. And this trend reflects the growing impact of the aging population and caregiving responsibilities, as I noted earlier. So there, yeah. So figure 5 is who are caregivers caring for, and the age of the caregiver of the care receivers. So that older age group, parents and in-laws. So, effects of caregiving, emotional, financial, and employment impacts. Women reported greater emotional and employment impacts from caregiving. Sandwich caregivers experienced the highest level of stress, financial hardship, and employment disruption. 92.7% of women sandwich caregivers reported impacts on well-being. And Ontario caregivers reported average monthly out-of-pocket costs of $758. That's a substantial contribution financially. Employment impacts were substantial for both men and women. So the charts that we have here, just really show you the proportion of caregivers by impact for caregiving responsibility. So the top one is for folks who are caring for adults only, middle is for children only, and then the sandwich care piece. And you can see that well-being, I don't think we can emphasize that enough in terms of what the impacts are, the stress piece. So again, just a little bit to that economic contribution, caregivers provide approximately 5.7 billion hours of unpaid care annually in our country. Replacing unpaid caregiving would require 2.8 million full-time workers and an estimated economic value of 97.1 billion annually, 42% of Canada's GDP. Take that in. That's a lot. So if you are in this role, thank you. And thank you for your contribution. And let's talk about how we can keep you well. Unpaid caregiving reduces pressure on our healthcare systems, long-term care, and community services. But I think today we want to talk about the caregivers and, this huge contribution. How are we ensuring that these people stay well? This is, it is, as someone who has been a caregiver, I understand it's a blessing to be able to do that for parents and your children, but we also need to make sure that you can carry on. We do hear that there are barriers, and the data points to that there are barriers and unequal access for some folks across the country. Many caregivers to supports. Many caregivers struggle to access respite care, financial supports, mental health supports, navigation of services. 46% of racialized caregivers reported financial hardship. 68 of BIPOC caregivers reported greater difficulty accessing supports. Language, cultural, and employment barriers continue to affect access to care, and long wait lists and fragmented services remain ongoing challenges. So it'll be interesting to hear from some of our service providers if wait lists are an issue. Just starting to wrap up here, future care needs in Halton. So just looking ahead, like will the trend of aging and disability people who need extra supports stop? And the answer is probably no. And approximately 23% of Halton residents age 15 plus reported a disability in 2022. One third of residents with disabilities report severe or very severe limitations. And Halton's population age 65 is expected to increase significantly by 2051. We're projected to represent 22% of Halton's population by that time. So caregiving needs are expected to increase as the population ages. And with age comes limited mobility and disability. So just quickly emerging themes, caregiving responsibilities continue to grow in scope and complexity. Women and middle-aged adults continue to carry the greatest caregiving burden. Caregivers experience emotional stress, financial pressure, employment impacts. Local organizations report increased demand, greater caregiver burnout, long wait lists for respite and support services, and caregiving remains critical to community well-being and health system sustainability. Some final takeaways. Caregiving is a huge part of our health and social care system, not well recognized, and we need to shout this out. There are Ontario and national organizations are doing advocacy, and we need to stand with them. Women, middle-aged adults, and sandwich caregivers continue to carry the greatest burden. Caregivers experience emotional, financial, employment pressures, and this caregiving contributes significant social and economic value to our country. And we will expect that the needs will increase. The report highlights the need for stronger supports, services, and recognition for caregivers. We always like to finish with some call to action. So we need to recognize and support caregivers. That you are a vital part of the health and social care system, including your perspective in policy and community planning is essential. We cannot plan without the voice of those who are experiencing the situation. We need to expand access to supports for respite, peer support networks, culturally inclusive programs, improve navigation services, and coordinated care supports. We need to address financial and employment barriers that stand in the way for caregiving. And we need to prioritize well-being and future planning for our caregivers in our community, increasing awareness of caregiver stress, burnout, and isolation, improve local caregiving data and research, and plan for growing caregiving needs as Halton's population continues to age. So I'm gonna stop sharing a second, but before I do, I want to actually, I'll stop and we'll come back. Those that you saw a shot of all the beautiful folks that are going to be on our panel. We've got lots of great folks in the room. Thank you for being here. I'm seeing you all again. Is there any quick questions for the Community Development Halton team who drafted this report? Anything in the chat, Heather, that I should know about?
No, nothing in the chat yet.
Nothing in the chat yet. For those who are showing the screen, anybody or you use your electronic hand, how many people have experience with caregiving in their life? Who has been or has been a caregiver? Yeah. Yeah. Beautiful. Yeah. It is a part of many of us. It's part of our life. And so when I was reaching out, so I just wanted to start to speak to our lovely panelists. Um, when we were going through the questions together, many of them asked, they said, am I to speak just on my professional hat on around caregiving? Because I also am a caregiver. And I said, no, come as a human and bring both. I think that so many of the good folks who are working in this field also are carrying the weight of caregiving as well, and the joy of caregiving as well. So I just wanted to share that, and I'm just going to do a quick introduction. I'll reshare my screen so you can see who we have um, coming our way. So we have four panelists. So we have Vintha Nair from Acclaim Health. Vintha is a manager of caregiving education and adult day and caregiver support. Acclaim is a registered charity providing extraordinary community care and support in home region for over 95 years. Yes, I read that right. 95 years. Isn't that incredible? They provide the care people need to live well at home for as long as possible. They cared for over 25,000 clients in Halton last year, two-thirds of whom were over the age 65. They have
Wow.
700 staff members, over 400 volunteers. Amazing. And they're committed to high quality care in our community. They're accredited, and they're such a great community partner with CDH. I just can't say enough about them. And I know Heather at some point is going to be putting some links into the chat. So if you want to check out all of the resources and the websites for these incredible panelists, please do that. We also, my Paula Woods. Here we go. I'm trying to go in order of the logos that you see here. Paula Woods is joining us from Community Living North Halton. She's a senior manager of compliance and community supports, and she oversees a team with respect to community participation programs, employment service, quality assurance, and policy development. And she's been with this agency for 13 years in lots of different roles. Community Living North Halton is an agency that supports children, youth, and adults with developmental disabilities. And they have 18 group homes within the catchment of Milton, Georgetown, and Acton. And they have homes that specialize in treatment for those who have severe behavioral issues and homes for adults with seniors. They operate a variety of community support activities. And I know that they also have programs for caregivers. So lots of incredible resources. And again, please check out their website. We've got some links there for you. Then we have Trish Maxwell here with us from Nucleus Independent Living, and Nucleus has got a few pieces to it. Trish is the senior leader that is and she's executive director for Nucleus. She's been working across the health ecosystem for over 30 years, and most recently she's with Nucleus, which is a 40-year plus grassroots organization in Halton, leading in current times with two regional programs impacting caregivers. Their Central Intake Registry and the Regional Learning Center program specifically for caregivers and the support locally and provincially. So she's looking forward to sharing her insights and personal experience this morning with caregiving.
So,
And
Risha,
last,
oh, sorry, go ahead.
yes,
No, go ahead.
okay.
Finish the introductions.
Okay, and last but certainly not least, is Crystal Becker, who is a parent and caregiver, peer support person with the Parent and Caregiver for Mental Health. We've known Crystal for a little bit. Always a true joy, and who's a contributor to our report. She's a mom of two boys with disabilities, and has found her experience as a recipient of peer support a lifeline. And her journey in the child and youth mental health and addiction sector began when she was a child in her own family origin, and specifically impacted by mental health challenges and addictions. She's had a beautiful journey to in community and in support as a peer supporter, and so we're really thankful for Crystal to be here. The Caregiver Connections group is run by caring volunteers with lived experience supporting their children with mental health challenges. She is one of the peer support facilitators who are passionate about helping others by sharing their experiences to empower and provide hope to others. So what an incredible team of folks that we have who have agreed to be with us today. So yes, Heather.
So there were just a couple of quick questions before we move into
Yes,
the panel. So,
sure.
question from Laurel: does the study cover caring for multiple adults at the same time?
Ooh. Specifically, oh, Richard. Richard, I don't know if that's a data point that we were able to access. Richard, my friend Richard Lau, are you able to answer
Yeah,
that?
right. I think these are individuals.
Just individuals.
Just
Yep.
Yeah.
individuals, okay?
Yeah.
And then Tina asks, researchers, did you use statistical data only or interviews for added qualitative information?
Great question. So the first part of the report actually uses just statistical data, but the last section where we were really digging for Halton data has some interviews and stories that have been provided by local folks, some of which are here.
Perfect. I'll put the link to the report back into the chat for everyone and
Wonderful.
we'll carry on. Thanks.
All right. Thanks for spotlighting these beautiful people that we have with us today. So thanks again, Crystal, Trish, Paula, and Vinta for being with us. So we're gonna just for folks watching, we're gonna go around. I've got 3 questions. We're gonna try and get through them, and we're gonna kind of go one person at a time with the questions. So um, my first question, folks, and maybe Crystal, you're on my screen first. I'm gonna start with you. Why do you think that talking about caregiving and caregivers is really important at this time, in this moment in time that we have?
Good morning, everyone. I'm Crystal. Thank you for the introduction, and happy to be having these conversations. I was one of the interviewees, so just to add in some information to that question, I also was a personal support worker in home and community support services prior to having my youngest child that was born with a rare physical disability. So I did that role for over 20 years. So lots of very realistic information that kind of is relative to all of the different caregiving roles. And I think that's the answer to this question is like, why are we talking about it? Um, Separating the person and the role, I find is extremely important because when I for one would love to just be a parent, being granted that ability would be really, really wonderful. Um, However, it doesn't take away from the fact that I also love and appreciate and I feel honored and privileged to be also a caregiver. But the roles are separate and they're different. And quite often, speaking from a parent perspective, and caregiving for 2 kids, ages 20 and 8 years old, um, I would say that that is that distinction between caregiver and being a parent is important to have these conversations
Mm.
because um, we quite often get overlooked, not valued, and we're just the parents. So sometimes we're even viewed as the problem when it comes to accessing the supports in the community. And us being cared for is an essential part of the humans that we are caring for. So, when the person that's caring for is well, right, the people that they're caring for will be well. So if we're not caring for, the people that are providing the care, then what is it that we're doing? Because I think that that's the only way that we can truly provide holistic care and holistic approaches to caring for individuals is we're a part of that system. And it's the same as if you're to have employees, like you're going to see better outcomes, right, when you're caring for your employees. And it works the same for caregivers. It's just we just so happen to not get paid and we're kind of overworked. So that is one of the important pieces, I think, of why it's important to talk about caregivers and caregiving right now because we are being relied on heavily by our systems. If you don't have an advocate or you aren't one yourself, then quite often you're underserved and services become inaccessible because they're not usable by the person that they're built for. So,
Wow. Crystal, thank you for sharing that.
mhm.
Thank you for sharing your heart. That was incredible perspective for all of us to hear. Thank you very much. Um, Vintha, I'm gonna pop down to you to hear what you might want to add to the importance of just even having this conversation today.
Thank you again for the introduction. I do apologize for the background noise. I'm off-site in a very public space, and my very lovely technical glitches, this doesn't work, and I don't know how to fix it. So I'm sorry.
You're good.
Apologize
You're
for
good.
that. I just want to add on to what Crystal was saying. I concur with all of those points. For me, I think the importance comes from giving a space for caregivers, holding that space to honor and acknowledge what they're doing. There's no one in this group, in this room, or in my community, in my family, in my circle of friends that hasn't been touched by the caregiving experience. So, and a lot of times in my role as a caregiver educator at Patty's Place, what I hear from caregivers is they need that space to be heard. A lot of times that's what we're doing. We're listening to them, just giving them that space, safe space to talk about the experience because, excuse me, social networks tend to dwindle when you become a caregiver. You know, when all is well, when you're not caring for people, you have all the time to socialize, to connect. Friends can hang out with you. That doesn't happen when you become a 24/7 caregiver without time to socialize. So I think what we're doing here is normalizing the whole experience. It's okay to be a caregiver. And you can still have friendships and other relationships and time for activities. You know, you've got to support that community of caregivers. And that for me is the goal here, to make our community a caregiver-friendly space.
Nice.
Because at some point we're all going to be caregivers if we haven't been one already.
Right. Thank you, Vintha. Yeah, wonderful. Trish, did you want to add something to that?
Well, they've said it a lot, right? They've already said a lot of great stuff. I just wanted to really sort of say for those participating today, as the sort of alluded to, we didn't actually sign up for the title of caregiving, whether we're a daughter or, a son, a spouse, and oftentimes we show up in those quiet times. And sometimes, as Crystal says, we have to get a little bit rambunctious to advocate, right? To navigate that. So just, thank you for that. I think we're really talking about it now, and it's so important is because it's really, even though we've got this, great report, it's really the least visible when we look at the home and community or health and community sector. It's not like it's part of the pathways. It's not like it's part of, I'll just say, the transparent solution. So for me, caregivers are really helping people, as we know, remain at home, stay connected within the community, do the appointments, navigate the services. And I think there oftentimes that bridge between the person receiving and again for myself have a special needs daughter, have had parents that are elderly, so right in the midst of all of this, really navigate the system. And I think this report starts to really highlight some further conversations that we need to have, like the calls to action are really, it's what we need to do. It's the right thing to do. And I think with, the nucleus lens, with our central intake, our registry, we get a lot of those caregivers calling us, searching for solutions, needing help in coordinating, at navigating, advocating. And every, phone call is a little bit different because they all have a little, nuances, right? And it's really about, I always say it's never a sprint. It's not like call, get the answer, done, whoo, I'm done, right? It's this real journey that the caregiver is on, and you have to pace yourself. And I think that, with some of the programs that we have, within the central intake, and along with our regional learning center, what we're trying to do is, tap into folks when they identify a need, because I think everybody's at a different point of identifying, right? When they need that help. So it's really, and I think it was Vinitha that mentioned, like, it's about creating that community. Because when you know that you're not the only person going through this, you actually start to feel, oh gosh, like I'm not alone, right? So I think, that's for me why it's significantly important at this time. It needs to actually be part of a solution for moving forward.
Wow. Thank you. Thank you for placing it in the system. I really appreciate that. That's wonderful. Paula, last but not least here on this question.
Okay, what do I add? Thank you everyone for all your comments. I think why this is all important, and you've all touched on it, is recognizing that the burden and the burnout is real. The stress, I was as caregiver for my mom, elderly, passed, and dealing with the whole hospital system, not out in Halton. If I have to bring it over back to the developmental sector where I'm from, where I'm working in, it's a fragmented system, and there's lots of other industries out here as well that has this fragmented system, and it's becoming a crisis. It is a crisis. And so I think this is so important that we're talking about this today, that we're putting ourselves out there, we're working on this all together, and we're bringing it back to the families and the people that are supported by this. And we have many staff that are also, they're caregivers, they're working in that caregiving role. It's very real. And, we're having conversations with those people. And I have a lot of conversations with family members, and they are very hard to navigate, and everyone is a different situation and path that they're all going to. But like you said, it's a call to action. How do we all get something together so that we can move forward with this?
Mhm. Thank you so much. I love that together piece that you're highlighting there, Paula. This is something. This is why we have these conversations at CDH, is to bring folks together. I love your collective voices in this direction. So thank you for that. Our next question, and you've already touched. I knew you would. We've already touched on some of the pieces around what are the most pressing challenges that caregivers face, and our data really pointed to, the economic stress, and the well-being stress. And I think we're talking here mostly about the well-being stress. Are there other, are there other nuances that you wanted to add? I'll just open up the floor on this one for anyone to jump in. But and I've also worked in developmental services, and I'm thinking about some issues around how families can plan. Again, sometimes it's situated in systems issues. But I wondered if there was something else anyone wanted to add before we got to our last question. Putting you all on the spot.
Well, I don't mind sharing
Yeah.
at all.
Great.
So I feel, oh, there's so many pressing challenges actually. So that's like a really loaded question, to be honest. I have quite a few bullet points to share on that.
Okay.
But more recently, the talk about AI is a
Oh.
big one in our system. And that parents and caregivers don't know how to navigate all of that. Our kids are facing a lot of really difficult things in real time on a day-to-day basis. Um, and our systems are disconnected in being able to um, and to be able to like assist in navigating. So the very real crisis, like I would say on the ground, like they're happening every day, all the time. And then our systems are disconnected and unable to provide the support that's needed in that real time. Um, and I bring up AI conversations because it's a whole other beast, really, in what is good care, what isn't good care. Um, these are our lived realities, and how do we kind of support healthy ways and healthy usage within the systems because people are relying, like if they are isolated, they can't access services, what do people turn to? Right?
Hmm.
They turn to a system, I would say like, the Google, but I would say taken over Google is our AI supports, right? It's kind of overriding all of those systems
Mm.
and it's not accurate. It's not, everything has to be fact checked. So that's just like one of those newer conversations that has kind of surfaced and like, how do we support organizations and our system work, in navigating that, right? And so that's one thing. And then I would say just with the emotional and mental health load and our current economy
Mm.
is an extreme weight that if you're a family that's already struggling, to add in all of these extra layers is it's drowning people. People are dying.
Yeah.
Kids are dying in system care. Um, and that shouldn't be. People are dying because of the weights that if you're in crisis, you need like support now. And our system isn't able to support that. Um, and it just drives all of that. Like you're usually clinging to like a little bit of hope in those situations. And when you turn to what you think is supposed to be that support that you're able to turn to, and they deny you, or there is that weight, or they turn you away and tell you to come back again. Um, that is the breaker, right? Like that's what ends up crushing people to hopelessness, right? And that I would say is like that real time lived experience that's happening. And our government, our government supports and the lack of understanding in what actually truly supports families. Um, it's all connected, right? Everything. So if you're struggling to care for, an elderly parent or a friend or colleague that has just been diagnosed with something, you know, and right? Like then you have your kids and then you have yourself and your partner and all of the things that come along in life, right? So the gaps in services, waiting for a long time to access the supports that we need in real time. Those are just a few things that are kind
Mm.
of on that list of what are the most pressing challenges
So
for me.
thank you. You basically just
you have to go and start with your local government. That's where we've got to put the push, your local MPP, for change. And there's lots of campaigns. There's the Ending the Wait campaign, the Waiting to Belong campaign in developmental services, that parents and caregivers can jump on for that. And then one thing that I just wanted to add on was that many families are that navigating the system, and they have their 2-year-old has a diagnosis of autism, and they're going through things as children and things that they have access to, and then they hit 18. Now you got to apply again. You got to apply to Ontario Disability Support Pension. You got to apply for passport funding. So they make them go through all of this, and that is really challenging for families navigating that system and getting that support and starting at the bottom again. So again, just like we said, these local calling for local change is and parents are the advocates for their loved ones.
Thank you, Paula. Yeah, so important. Yeah, to speak up about those system changes that are so necessary. Anything from a claim health perspective that you want to throw
Sure.
into the mix here?
I'm going to jump on the bandwagon with all three of them and what they said. I think what I want to add to that is the call to action would be more for a synchronized chain of services. Almost, a little bit of what Trish said with we need to be proactive. So starting with the risk reduction, creating the awareness in the community. But if you are dealing with, a 2-year-old who's now been diagnosed with an illness or a need, then we have them connected to services right from day one. We have to have that support. So many wonderful organizations here, right here in this room, right? If we can just be so coordinated that here's a point of contact, I'm going to pass on the referral to you, and then we do what we can offer that family. Then we pass it on to the next the next organization or agency for supports. That would trigger the supports when they need it. Again, going along with you're not alone. There's this whole support system that we can offer, but there needs to be that coordination. At this point, I think a lot of what Crystal was saying too, it's very fragmented. Caregivers, stumble on us and the services that we are offering. We get referrals to Claim Health and the supports that we offer through word of mouth. It would be lovely if we could have that centralized, just kind of, similar to what Central Registry is doing, and then hold that database, pass the referrals on. Also for, the kaleidoscope of services that we offer here. I don't know all the services that exist in the community, but it would be nice if we could start creating that. Maybe involve caregivers in the, policy and decision-making process, because their experiences are so unique. Everybody's going through a different experience with their person. And there's no way that any organization is able to address all of those needs. But if we are able to work together, then we are giving you a very wholesome caregiving support experience. So I think that was on top of the list for me. And of course, the wait lists, and, if we could add, there's so much demand. It's only going to go up, not down. We all know that. So what can we do about that to reduce the wait lists? And then the whole other thing that we hear a lot from caregivers after COVID, more so, is the hospital experience. And how do I navigate the system when I'm in the hospital or when I am discharged from the hospital? Now, what supports can I access? So that would be, I think, if we could come up with some resources and a plan to support caregivers through that part of the journey would be great. Because I have caregivers in their 80s who are ready to have their spouses go into long-term care, and we just don't have the supports to offer. So what can we do for those special circumstances, I would call it, right?
To add on to that, it's like, what are the options? I think all of this speaks to accessibility. of services and the broad sense of support provided in a way that a user can use it. Otherwise, what is the point of creating all of these things that are siloed if it's not actually being created for and usable by the people that are using it, right? So having built-in options for access points, just online isn't cutting it,
Mm-hmm.
right? You have to have in-person, you have user guided and choices, informed decision making. Here's all of your options. Which one suits you? Which one matches you and your needs and your dynamic? That way, like it's something very, very simple that can be easily implemented, but we're not doing that at the beginning of when people are accessing these services. So, to your point, Vinitha, um, is retirement homes and long-term care homes. They're just like those are just two options to the array of different things that can be available that can get a person to that point, right? So how are we supplementing, that pathway to, potentially a long-term care home? Because the reality is for long-term care, you're waiting for somebody to die in order for a bed to open up. That's the reality, right? When it comes to long-term care. There was a transitional bed support program that had been piloted right when I was ending my career, I guess, in community supports in that perspective. And it was a realistic, I feel like transition support, had some flaws with like how people were transitioning, and many needed to go into palliative care versus necessarily the critical wait list, things like that we were seeing in real time. But we have all of those options available in all of the systems of care. It's just a matter of everybody understanding what each pathway takes and having somebody to support. So I just wrote down, like, I'm like, we need helpers. We need, a clinic, a consultation clinic. You know how we have tax clinics? Have a consultation clinic in the community where you can have individuals like us. Like I know I volunteer. I probably volunteer too much. But that being said, I feel like, we use what we go through to help support others, right? And that is kind of that principle that I live by, and sharing what you've been through, because it might be the little bit of hope that the next person has to carry them forward. So yeah, those were just a few of the things I wanted to touch on. Also, parent caregivers were being locked out at 18. I would really love to see like supports like assistance for children with